Facing any medical procedure can feel daunting, especially when it involves an internal examination or the possibility of a serious diagnosis. Understanding what to expect can greatly ease your mind and help you feel more prepared. A bladder biopsy is a medical procedure where a doctor carefully removes a small piece of tissue from the inside lining of your bladder. This tissue sample is then sent to a laboratory to be examined under a microscope by a specialist called a pathologist. It is typically performed to investigate any abnormal cells or growths that may have been observed during a previous test, such as a cystoscopy, which helps doctors accurately diagnose conditions like bladder cancer or other bladder abnormalities. The primary reason for performing a bladder biopsy is to obtain a definitive diagnosis. While a doctor can visually inspect the bladder lining during a cystoscopy and note suspicious areas, a biopsy provides crucial microscopic evidence. This examination allows the pathologist to determine whether cells are benign, precancerous, or malignant, and if malignant, to identify the specific type and grade of cancer. This detailed information is absolutely vital for your healthcare team to develop the most effective and personalized treatment plan for you. The procedure itself is usually performed on an outpatient basis, meaning you can go home the same day. You will typically receive either general anesthesia, which means you will be completely asleep, or regional anesthesia, which numbs the lower part of your body. The doctor will insert a thin, flexible, lighted tube called a cystoscope through your urethra and into your bladder. Small instruments pass through this scope are then used to collect the tissue samples from any suspicious areas. The entire procedure usually takes about 20 to 40 minutes. During the biopsy, the medical team is not only looking for the presence of abnormal cells, but also assessing characteristics like how deeply any abnormal cells have invaded the bladder wall. This depth of invasion is a critical factor in determining the stage of a potential cancer, which directly impacts treatment options. For example, a superficial cancer might be treated differently than one that has grown into the muscle layer of the bladder. The pathologist's report provides this detailed analysis, giving your doctors a comprehensive picture. After the biopsy, you might experience some mild discomfort, a burning sensation when you urinate, or see some pink-tinged urine for a day or two. These are generally normal side effects. It is important to drink plenty of fluids and follow any specific instructions provided by your medical team, such as avoiding strenuous activity for a short period. Your healthcare provider will schedule a follow-up appointment to discuss the biopsy results and outline the next steps in your care, providing you with clarity and direction on managing your bladder health.